Hyperkalemia, that means hyper or increased levels of potassium in blood. Particularly, levels more than 5.5 millimoles per liter are considered to be hyperkalemic. This increase in potassium in blood leads to certain ECG changes which ultimately help us in diagnosing hyperkalemia. Whenever you come across hyperkalemia, you have to start prompt treatment, as hyperkalemia is a medical emergency and can cause death at any moment. So the treatment of hyperkalemia is remembered by a simple mnemonic, which is cabbage, CABG and D, cabbage D. C stands for IV calcium. We give IV calcium to stabilize the cardiac function and prevent the heart from hyperkalemia induced ECG changes and arrhythmia. This is required to prevent a cardiac arrest which may kill the patient instantaneously. However, this IV calcium does not contribute to lowering potassium levels in the blood. Then A stands for albuterol, which is basically a beta-2 receptor agonist. This beta-2 receptor agonist helps in intracellular shift of potassium. It causes shift of potassium within the cells. The most common route by which we give albuterol is by nebulization. And the doses used for hyperkalemia are generally higher than the usual bronchodilator dose. Then B stands for bicarbonate or sodium bicarb. Sodium bicarbonate leads to a situation in the blood, it leads to alkalosis. In alkalosis, as you can remember, I hope that K is low in alkalosis. That means alkalotic condition leads to decrease in potassium in the serum, and thus bicarbonate helps in lowering serum potassium. Then we have G. G stands for two things. First, G stands for glucose plus insulin. We give glucose plus insulin to shift potassium within the cell. Actually, we want to give insulin. Insulin will cause shift of potassium within the cell, but at the same point of time, it will also cause glucose to shift within the cell. So as to prevent hypoglycemia, we also provide extra glucose with it. Or another thing that we can do, we can give gastric cation exchangers. That means we give certain oral solutions which go into the GIT and cause cation exchange and thus decreases potassium absorption. Then we have D. D stands for 1. Diuretics, particularly loop diuretics and thiazide diuretics. They cause potassium excretion via urine and lead to hypokalemia. And this effect, or rather this side effect, can be used as a treatment of hyperkalemia in patients particularly with volume overload. And finally, when nothing else comes handy, you can go for hemodialysis, which will set the electrolytes and acid balance in the blood. And this treatment protocol can be remembered by a simple mnemonic, that is CABGD or cabbage D.